Hypertension, or high blood pressure, is a disease that affects roughly 30% of the UK population, although many people don't realise that they have high blood pressure. Having high blood pressure can significantly increase your risk for the development of more serious cardiovascular diseases, such as heart attack and stroke. Fortunately, there are ways that you can reduce your risk for having high blood pressure, and these include improvements in diet, stopping smoking, and increasing the amount of exercise that you take. Furthermore, there are a wide range of drugs available used to treat hypertension, and of these, the angiotensin-converting enzyme inhibitor, or ACE inhibitor family of drugs, are routinely prescribed. Some drugs in this family include enalapril, captopril, and ramipril. ACE inhibitors work by blocking the production of chemical signals your body uses to maintain a healthy blood pressure. Under normal conditions, when your kidneys sense a drop in blood pressure, a substance called angiotensin-1 is released into the blood and circulates. However, angiotensin-1 is mainly thought to be relatively inactive, and it needs to be converted into another hormone called angiotensin-2 in order to have its main biological effect. And a protein called angiotensin-converting enzyme, or ACE, is responsible for this conversion of angiotensin-1 to angiotensin-2. Angiotensin-2 works to increase blood pressure by narrowing the blood vessels and increasing the amount of fluid that is circulating in the blood. By narrowing the blood vessels, angiotensin-2 can increase resistance within the circulation, and this drives up blood pressure. Similarly, if angiotensin-2 can increase the amount of fluid that's present in the blood, this means that the heart needs to work much harder to pump this blood around the body, and this drives blood pressure up even further. People with high blood pressure generally have high levels of angiotensin-2 within the circulation and high levels of activity associated with this hormone. So if these levels are high, then this presents a good strategy by which we can attempt to block signals produced by angiotensin-2, and that's what ACE inhibitors do. Because angiotensin-2 works to increase the amount of fluid that's present in the body, these drugs may also be valuable in the setting of congestive heart failure. ACE inhibitors work by blocking the formation of angiotensin-2 from angiotensin-1 by the action of the angiotensin-converting enzyme ACE. Chemical reactions that are performed by enzymes are highly specific, and only chemicals with the right shape can fit into the active site of the enzyme. Just like only one key can open one lock, only one enzyme can perform one particular chemical reaction. ACE inhibitors work by sitting inside the lock, or the active site of the enzyme, and preventing access of angiotensin-1 into the active site. Therefore, when the ACE inhibitors are bound to the enzyme, angiotensin-2 can no longer be formed. If angiotensin-2 can no longer be formed and levels are lower, then this should work to reduce blood pressure. Patients who receive angiotensin-converting enzyme inhibitors for the treatment of hypertension usually see quite a rapid reduction in blood pressure, although patients that are taking these types of drugs for the treatment of heart failure may need to take them for a longer period of time in order to see any benefit. Whilst generally considered safe and side effects minimal, there are other drugs available to block the action of angiotensin-2 called angiotensin receptor antagonists. These may provide similar clinical benefit, but may get rid of some of the side effects associated with ACE inhibitors.